Thank you, Tim Mauri, for talking to us today about Ethicon's MOOC, made for training surgeons in bariatrics, or training, I think, various people in the bariatric community. Please tell us about yourself first, please.
Oh, sure. So I work for Ethicon, a medical device manufacturer. I think probably a lot of your viewers will already be familiar with. We're about 85 years old. Our history is mostly in wound closure, but we've grown over the last 80 plus years to be pretty ubiquitous in operating rooms. My role within Ethicon has been, for the last several years, focused on the educational aspects. So our professional education department, where we train mostly surgeons, but other healthcare professionals as well, on our medical devices and where they fit in within the given procedures. So that's been my role the last few years.
Okay. And so the MOOC is the interesting thing to me. Tell us what a
Yep.
MOOC is.
Sure. So historically, we've done our professional education. If you're a surgeon watching this, you maybe have attended one of our professional education events. They've been in-person events typically, right? You come into a certain location, you get trained for a day or so, and then kind of you're off and running back to your practice. We've started to dabble in online education, and we've sort of had some stops and starts. In my role in professional education, started looking at what's going on in the higher education space with universities and in terms of how they're attacking online education. And there's this recent movement called Massive Open Online Courses, or MOOCs. They've really taken off in the last couple of years. There was an interesting article in the New York Times back in November of 2012 that proclaimed 2012 as the year of the MOOC. I highly recommend checking out the article. But what a MOOC is, it's a massive open online course. So the online course, that's nothing new, right? Online courses have been around since the 1990s and have historically not been that great, to be honest. What's interesting about the MOOC is that they're massive and open. So what does that mean? Massive, right? These first iterations of the courses, the first one I think that got huge attention was a course run by a Stanford professor on artificial intelligence. So he opened it up to the world and said, anyone with an internet connection anywhere in the world can take this course. And he had no idea what to expect as far as how many people would jump on and do it. And so you think, well, how big is massive? He had over 160,000 people register for that course. Mm-hmm. So, I mean, just huge. And then the open aspect, of course, is just that it's open to anyone, anywhere in the world. So he ran that course at Stanford, and then I think based on seeing just what the demand was, he then went off and launched a company called Udacity, and that's one of the MOOC providers. A couple other Stanford professors launched another one called Coursera, and then in 2012, Harvard and MIT got together and launched a nonprofit called edX. So those are your three kind of big MOOC providers. What's different about them is that they are very much tailored for an online audience. So the analogy I like to use with people is that a lot of online education historically has been the equivalent of filming a play and calling it a movie. And if I had a hit play on Broadway,
so you're not adapting the content correctly.
Exactly. So you've got to design for your medium. Mm-hmm. And that's what these MOOC providers have done a good job of building, platforms that really are appropriate for an online audience that keep the learner engaged. So
okay.
Yep.
And so the course content of the MOOC that Ethicon is making is mm-hmm. around bariatric surgery.
Yeah, it's interesting. So our course is based on a research initiative that we launched in 2007 called MARS, and that stands for the Metabolic Applied Research Strategy. What's interesting about it, I think, to folks watching this is that it has nothing to do with our devices. So this is not a course that you would come in and learn about Ethicon's devices. It has nothing to do with that. MARS is our attempt at really deconstructing bariatric and metabolic surgery, understanding how they work, and then using those insights to better predict outcomes, to improve existing therapies, or even to potentially invent newer, less invasive ways of combating obesity. We've learned a lot from MARS over the last 6 years. It was launched in 2007. And this is our attempt at just sharing out those findings, because we really think a lot of what we've learned from MARS debunks several kind of controversial obesity and bariatric surgery-related myths. And sharing those findings, we think, will change the conversation about obesity and the role of bariatric surgery. So that's really what the course is all about. It has nothing to do with, I think, Our entire course, not one of our medical devices is ever mentioned, and I think the word Ethicon is said like once, and then you're just off and running. It's really about the science of the surgery.
Okay. And so how did you develop the content? Who helped in creating the course and its content?
Sure. So of course we relied heavily on our two lead researchers that we partnered with. So there's a PhD named Dr. Randy Seeley out of University of Cincinnati, and then Dr. Lee Kaplan, who runs the Obesity Institute at Mass General Hospital and is also a Harvard professor at Harvard Medical School. So the two of them were sort of the guys who had the content. And we've done stuff with them in the past where we've done in-person educational events with them. So we had their content. And then as far as shaping it, it was a small team of us who got together, a little bit of internally, and then we hired a small consulting company that helped us kind of package the instructional design aspects, a small company called Nodal that helped us do it. But it was really it was a very DIY, do-it-yourself mentality as far as building the course goes. It was a really small team of us that put it together.
Okay. And how is it structured for the person who takes the course? Like if I want to take it, how long does it take? What's my commitment? Yeah.
So the course, it's you can do it on your own schedule, and that's one of the beauties of MOOCs is that it's not like you have to be in front of your computer at a certain time to watch the lectures or what have you. Each week, new content is released. So you get a week's worth of content at a time. Our course is a 6-week course.
Is it available already?
It is available for registration, but we haven't officially launched we haven't announced the launch date just yet.
Okay, and we're just for reference, we're in late March right now of 2014.
We're in late March right now. Yeah, so it'll be announced. The course launch date will be announced soon. But anyway, you come into the course. Content is released each week. You could wait till the 6th week and plow through all 6 weeks if you want, or you could do it kind of on schedule. It's about, I would say, 40 to 45 minutes of video recordings per week. They're chunked into little bite-sized pieces, though, so I don't think we have any videos that are longer than about 6 minutes or so. Mm-hmm. So you're very active as a learner. You're watching a short video and then being asked to reflect on it or to engage with your fellow learners about what you've just seen and how you might apply it in your practice, or how you might discuss things differently, or how would you approach a patient who has insufficient weight loss following surgery. We'll pose those kinds of questions to you, and we hope to foster a lot of dialogue between learners. We don't want learners to come in and just engage with the content. We want them to engage with one another as well.
Yeah. So there's a forum on there for asynchronous conversations around the content.
Exactly. So you'll watch a short video and it'll say, okay, based on what you just saw, answer this question in the discussion forum below. And it's, you just type away. Okay. We also hope to incorporate some live events into the mix as well. So maybe we'll do a Google Hangout with one of the faculty, for example, and we'll offer that up as an option. Or we may migrate some of our conversation out to Twitter, for example, and say, hey, this week at 7 p.m. On Tuesday night, we're going to do a little chat on Twitter, exploring the following questions. Hope to see you there.
Okay. So there'll be video content, questions. Will there be text? Or will there be assignments where I have to go read 4 chapters of Schwartz? Or
no, nothing too demanding. The video lectures are the most of the content. There's a little bit of text kind of before and after each video, a few graphs to look at and things like that. And then as far as readings, it's really what we tried to do is expose you to some content, video content, and then we'll say, okay, now that you've watched that and absorbed that, read this article, but it's often not a journal article in a medical journal. It'll be like, read this New York Times article about obesity, and the columnist makes a certain argument about the nature of why the U.S. is suffering from this, obesity epidemic. Mm-hmm. Based on what you just learned, how would you respond to that? Mm-hmm. And then we'll open it up for discussion. So it's pretty informal. We had to be, look, we're mindful of the fact that surgeons are very busy people and they don't have hours and hours to spend each week, diving into, content like this. So we're mindful of our audience.
And who do you hope will participate aside from surgeons?
Yeah, so the course was designed with the bariatric surgeon in mind. We feel like surgeons certainly need to really understand the physiological mechanism of action of the surgery that they do. And that would help them to, have different conversations with their referral base and even with patients. That said, it's certainly appropriate for any healthcare professional who deals with patients suffering from obesity. I think would stand to benefit from checking out the course. I mean, one of the nice things about these courses is that you can come in and come out. There's no barrier to entry. There's no barrier for you to leave. So if you want to take the whole 6 weeks, great. If you just want to come in and kind of check it out and see what it's all about, that's fine too. You know, there's no harm in that. So I think really anyone who's at all curious about the science behind why we've become more obese over the years and how bariatric surgery really works. I think there's a lot of misconceptions about how the surgery works. Anyone who's curious about that ought to check it out.
Okay.
Yeah.
So in terms of other plans for Covidien I'm sorry, Ethicon.
Yeah, I don't know what Covidien's planning. No worries.
Are you planning other courses, or are you waiting to see what the uptake is like on this, or how did this topic get chosen for a first MOOC?
Yeah, so it's funny, I sort of had the idea. I'd been just kind of following what was happening in the MOOC world and thinking this has got to be a good approach even for surgeons. And so I had wanted to try this with some topic. And for a variety of reasons, we settled on trying it with this metabolic applied research strategy, or MARS. So that's going to be our first launch. We have another small team currently working on developing our second course on a totally different topic. It's actually on C-section closure techniques, how to avoid, how to avoid or how to best close the incision. And then I think we've got ideas brewing about other topics we could do. I think that the future of this is not just doing it as an online thing, but as a form of blended learning, where you've got some learning taking place online and some in person. So we already do a ton of in-person training. We'll bring people to Cincinnati to our facility there and train them on, for example, ventral hernia repair techniques. Why not do some of the content online first, bring people in at a higher level of knowledge and learning, and use that time together to really have interactive discussions versus, a key opinion leader standing behind a podium lecturing to you with PowerPoint slides.
Yeah.
If we can kind of do a lot of that online in a more engaging way, and then when you come in person, really spend time with, participants bringing case presentations and sharing their own learnings with one another, I think that would lead to a better learning outcome personally. Yeah. So I think that's kind of the future of where we may be able to take this. That said, I should be clear. I'm obviously an employee of Ethicon. I'm appearing here on my own, not as a company spokesperson. So what you're getting today is my opinions and not necessarily those of Ethicon. I should be clear about that.
Okay. So as far as I know, this is the first MOOC available for surgeons on any topic that I'm aware. So I think this is interesting. Anything else you'd like to say about this upcoming MOOC for bariatric surgery?
I'll say this. MOOCs have become this huge thing. The two top providers, there's one called Coursera. They've got over 5 million people registered taking courses on their platform. We've partnered with a nonprofit, edX, founded and governed by Harvard and MIT. They've got over 2 million people participating, which tells you there's a big demand for just lifelong learning that was unmet and is now being met.
There's a bigger demand for signing up, I've heard, than for finishing the courses.
Absolutely. And that's a sort of a separate topic as to how do you define success of a course? Is it completion rate, enrollment rate? People come into these things with different agendas. So it's not really fair to assess the quality of a course based on the completion rate if I come into the course never intending to complete it in the first place. Like I mentioned earlier, some people are going to want to come in and just sort of check it out, and that's okay. Bottom line is people are curious. They're curious enough to sign up and check things out. And my hypothesis is that surgeons are ready for this sort of thing too, and I'd like to prove that out. This is very experimental. We have no idea how this is going to go. We're going to turn the lights on this course at some point and hope that people start showing up. I don't know whether you all will or not. I hope you do, because I know we've designed a really good course. We're going to run this MARS course 3 times this year. I know that the first running is going to be good, and I also know the second and third will probably be even better because we'll have taken some learnings from that first running and we'll improve on it. But our feeling is, if we're using the edX platform, we feel like if Harvard and MIT can't figure out how to deliver a good online learning platform, then we're doomed. So
Well, good. Well, we look forward to checking in. We'll check in again after we hear. We'd like to hear how the course is going after a while.
Absolutely. Hope to see you. Hope to see you all in the course, and we'll definitely check in with you again.
Okay. Thanks for talking to us today.
You bet. Take care.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.